Jonathan Berman is the author of Anti-vaxxers, How to Challenge a Misinformed Movement. He joins me now live from Jonesboro and Arkansas in the United States. Thanks so much for being with us, Jonathan. I appreciate it. I mean, tell me how concerned you are actually that this vaccine or vaccines could potentially fail because we won't be able to reach that critical mass, of 50 to 75% of the population volunteering to be vaccinated.
So actually not very concerned for two reasons. One is it's going to be a long time before there's more vaccine than people who really want the vaccine, because there's a lot of people who are going to line up to get vaccinated, and that'll take months. So we now have a few months to get the messaging right. And the second reason is that people tend to respond more negatively on surveys, but when it gets to be time to be vaccinated, most people do. And you see that with things like the measles vaccine, where people will respond on surveys that they have hesitancy or skepticism. 30 or 40% of people might say that, but about 85 to 90% of people will get vaccinated when it comes down to it. So I'm optimistic that enough people will ultimately get vaccinated to provide a sufficient level of herd immunity. That being said, we need to start working on our messaging now, addressing misinformation, addressing people's concerns to try and help them understand why this is important and the real benefits of getting vaccinated.
Right. I mean, just as a side note to that, does it help when airlines, for example, certain airlines are planning to make COVID vaccinations mandatory in order to fly? Could that help boost some numbers for people getting vaccinated, because it will make their lives terribly inconvenient if they can't get around?
Right. So one of the strongest motivators for people are incentives that we can create as a society. So if you want to fly somewhere, you need to prove you've been vaccinated. If you want your children to be enrolled in school, you need to provide documentation. Certain jobs will likely require documentation that you've been vaccinated. And those incentives really encourage people who are on the fence or are ambivalent to get vaccinated. And so once you have the 50, 60% of people who really want to be vaccinated and the 10 or 20% of people who are ambivalent but can be encouraged with that kind of incentive, then you're left with the percentage of people who need to be persuaded.
Okay.
And that's a much smaller part of the population.
Okay. It's encouraging to hear you say that. But since you know the history, so well of the anti-vaxxing movement, I want to ask you this. We can understand in some ways the reluctance to take a coronavirus vaccine because, it hasn't even reached the market yet, and just people don't feel like it's been around long enough to trust it. That's normal. But the anti-vaxxer movement itself, started well before COVID-19 became a problem. And they started, protesting against vaccines that have been around for ages and, saved millions of lives. When and why did people stop trusting vaccines?
There has been skepticism about vaccines and vaccine hesitancy and even anti-vaxxers since the first ever vaccine in history. And people have natural fears. They're afraid of government being imposed in their medical decisions. They're feared of what's in the vaccines they might not know or understand. And they're afraid of having their autonomy taken away. And those natural fears, when they combine with misinformation, can become vaccine hesitancy. And so when they make their risk assessment, you see a lot of the same things that are said now. I don't know how safe it is. I don't know what's in it. Those are the exact same things people were saying in 1950, in 1850, in 1800. So vaccine skepticism is nothing new.
Okay.
And we now have 200 years of experience combating it.
Right. If you can give me an honest answer here, I'd appreciate it. When have, vaccines actually backfired or caused adverse effects?
So there have been a few incidents in history. A famous one is the Cutter and Wyeth Labs incident, where about 200,000 doses of the Salk polio vaccine were improperly inactivated with formalin. And that resulted in about 200 cases of paralysis from polio infections that were caused by that improperly inactivated vaccine. In the 1970s, there was a case of a vaccine that was rushed and ended up causing a very small increased risk of Guillain-Barré syndrome. I believe in Europe there was a vaccine that ended up causing an increased risk of narcolepsy. So there have been a few incidents. I don't have those concerns here with the vaccines that look like they're in the pipeline coming up.
Okay, that's good to hear. Jonathan Berman, thanks so much for taking the time. We appreciate it.